Good. I'm gonna have you take a deep breath in for me, Erika. Good, and go ahead and breathe out. Checking again for capillary refill. I'm just going to hold down on your finger. Good.
F, P, H. No.
I'm just gonna pull your hair here.
Yes. Good. Yes. 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 Yes.
Hello. Hi, Erika. It's very nice to meet you. My name is Dr. Perez. Welcome to the clinic. I have you in as a first-time patient today. Okay. So it looks like I have you in for, let's see. Okay, so you're here for just a wellness check. It looks like an annual head-to-toe assessment. Okay, all right. Well, thank you so much for coming in. I do have your chart here. So, Erika. All right, and like I said, it looks like you are a first-time patient, so we're just doing kind of a general once-over, make sure everything's working okay today.
Yeah.
Did you have any specific concerns for me? Was there anything in particular you wanted me to have a look at?
No, just overall.
Okay, all right. So I'm going to confirm a couple of things here before we get started. Let's see. Looks like my medical assistant already took some of your preliminary assessments, so your emergency contact and code status, all of that is already on file and up to date. Phone number and everything is up to date. It looks like we did have an update for your address, so she took care of that. Okay. Looks like she did not obtain your vital signs, which is totally fine. I will go ahead and do that. So, can you tell me a little bit about how you're feeling today? Are you overall generally well?
Yeah, pretty good.
Pretty good? Yeah. Okay. Have you been unwell at all recently as far as like any viruses? We just kind of surpassed cold and flu season. Did you do okay?
Yeah, just some allergies.
Some allergies, okay. Do you typically have allergies?
Just with dust.
Okay. All right, okay. I suffer from seasonal allergies, so I certainly sympathize with you there. Okay, dust. All right. And then for that, do you ever have to take anything?
Just sometimes Claritin.
Claritin. And you find that that helps you pretty well?
Yeah.
All right. No recent injuries, recent falls, any blows to the head, anything like that? My hair keeps getting caught in my pen. I'm so sorry. All right. And it doesn't look like you've had any surgeries in the last 5 years. I didn't see anything documented.
No.
Okay. All right. And as far as your sleep wellness, anything concerning there? Have you been sleeping pretty well?
Yeah, I get
6 to 8 hours?
Yeah, 8 hours a day.
Good. It's about average. I always recommend trying to aim for closer to the 8-hour mark, but obviously, depending on your living conditions, those are variable. As long as you feel like you're resting well, that is fine. Any issues with your diet?
No.
Good. All right. Let's see. Looks like she already asked you all of our demographic questions. All right, so it looks like the last thing I have is just, are you in any pain today? Any discomfort, any headache symptoms, migraine, nothing like that? All right. And then as far as the physical exam itself, I will be testing kind of basic functions, head, eyes, ears, nose, and throat, of course, having a look at your neck, just a brief look at your scalp, upper extremity, lower extremity reflexes, that kind of thing. Any discomfort I should be aware of upon palpation?
No, you're good.
Okay. And no issues with your eyes recently. I see that you're wearing glasses. Are those prescription?
Yeah.
Okay. Is that prescription up to date?
Yeah, just one like a few months ago.
Okay, so you're up to date with your optometry. Did anything change with that prescription when you went, or did it remain the same?
No, my vision
Got a little bit worse?
Yeah.
Okay, all right. All right, so just something to make note of there. I'm glad you're staying on top of it. Do you wear contacts as well, or just glasses?
Just glasses.
And as far as your dental health, have you seen your dentist recently in the last 6 months or so?
Yeah, about 3 months ago.
Okay, so very on top of your health. Love to see that. Good. All right, that is all good to go. So I'm going to set this down and we can go ahead and get started with your examination. Okay, so why don't we start with just obtaining your vital signs. Sometimes they get a little bit backed up at the front, so I like to go ahead and get them if they're not already documented. Do you have a preference which side I take them on? Okay, so I'll use your right side, just it's a little bit closer to me. All right, so I'm gonna go ahead and place this on your forearm. I'm sorry, your upper arm. It's gonna get a little bit tight, shouldn't cause you any pain. So I'll just have you relax your arm down for me. Clip that there. Do you have any history of hypertension or hypotension, any arrhythmias of the heart?
No arrhythmia, but just sometimes high blood pressure.
High blood pressure, okay. Is that controlled by medication or?
No, it's just with the fibromyalgia.
Okay,
Sometimes
okay.
I
So just
get,
a history of?
anxiety and stuff,
Okay.
yeah.
So we will definitely have a look at that today. All right. So I'm going to place this on your opposite index finger. That's just going to read your oxygen saturation. So I'll just have you relax your arm for me. I'll just place this here at the inner elbow. Make sure I can auscultate appropriately. Okay, so you are going to feel this pump up. It's going to get just a little bit tight, okay? Okay, all right. So your blood pressure was borderline hypertension, so you're at about 138/72. So your systolic is just a little bit high, but it's nothing that is actually, you know, hitting over the hypertensive line, so that's okay. And like you said, you're already aware of it, and I'm sure your specialist is keeping an eye on that for you, so that is okay. I will go ahead and document that today, just so we have it in your chart. And then if I look at our monitor, it does look like, let's see, yes, your heart rate is well within normal limits. So you're at about 87, which is totally fine. Oxygen saturation was normal as well, 99%. So you're getting adequate oxygen, which is obviously always a good thing. So the last thing I'm going to do as far as your vital signs is just obtain your temperature. So I just have a thermometer gun. I'm going to point it around different areas of your face. Pretty standard, just checking for any increase in temperature. So far getting a base reading of about 97.3, slightly warmer at the neck, just a little bit. It's fairly warm outside today, so I always take that into account. Do see just a little bit of variation in areas of the face, so slightly cooler at the forehead, and then just a little bit warmer down the neck. So I will do some palpation here around the lymph nodes, make sure there's no signs of swelling there, but nothing that's reading particularly abnormal, so that's all good. All right, so let me just go ahead and put this away. And then following up on your vital signs, I'm going to perform a stethoscope auscultation. So I'm going to listen over your heart and lungs and just listen for any defect there. All right. So I'm going to have you just take normal breaths for me, okay? So I'm going to start here at the upper right side. So I'm just listening for overall healthy perfusion of the heart, ensuring there's no signs of occlusion or any abnormality. Specifically listening for symmetry. Very good, nice and strong. Heart rate is consistent with our monitor reading, so you're at about 86 beats per minute, which is well in line with normal. I'm just going to listen at the abdomen, just in line with the rib cage. Very good. So I'm just going to come behind you, listen to your lungs. All right, so I am just going to listen over your lungs. To start with, I'd like you to just breathe normally for me. So just normal, regular breaths. Very good. Now have you take a deep breath in for me, Erika. Good, and go ahead and breathe out. And one more. And breathe out. Good, so you're gonna feel me tap just like this. When I tap, I'd like you to say 99, okay?
99. 99.
Good.
99.
Good.
99.
Good.
99.
Very good. Okay, all right. I'm gonna come back around the table. All right, Erika, so we have completed your initial vital sign assessment. So I am just going to update my notes here. So, blood pressure. Your respirations, 99%. So your cardiac assessment was really fine. I didn't hear anything abnormal there. Very equal bilaterally on both sides. I didn't hear any, increase in your heart rate or what's known as tachycardia or a decrease bradycardia. Everything there was fine. And then your lung auscultation was well within normal limits. So you're able to take deep respiration. I didn't hear any abnormality there as well. So that's very good. Okay. And you don't have any respiratory conditions like asthma or anything like that? Okay. All right. Very good. Okay. So let's go ahead and move on. So we're going to start doing a bit more of the physical exam now. So I'm just going to cleanse my hands. I've just got some isopropyl alcohol here. So I'm going to place a pair of gloves on just for this portion of the assessment. And I'm going to be feeling around, a bit around the hairline, around your face, upper, lower extremity, that kind of thing. So you can let me know if any of that causes you any discomfort, if there are any areas of tenderness, things like that. All right, Erika, so I'm coming in for the palpatory examination. So you're welcome to close your eyes, leave them open, whatever's more comfortable for you. The only thing is I do want you to let me know if anything causes you discomfort, okay? So I'm gonna start up at the cranium. I will feel around on the back side as well, but I'm gonna start here just at the front. So I'm gonna feel around the scalp for any areas of concern. Specifically checking for any lumping, any bumps on the cranium, anything abnormal in the skeletal structure. Any signs of swelling, particularly around the temporal region, and then I like to feel back behind the ears, following down that temporal mandibular joint here. And coming down towards your jaw, following along your lymph nodes. I did feel I did see some warmth on my thermometer earlier, so I just want to feel for any signs of inflammation here. So far, nothing notable. So I'm just going to palpate along your brow line here. No signs of inflammation there. I feel just here along the gum line. Okay. So I'm going to come down along the clavicle, feeling along your clavicular region. You have a chain of nodes that runs here just at the chest walls. Just following that down. So come to your upper extremity, feeling up the joint at the shoulder. So I'm going to feel at the ulnar bone, just feeling along your elbow. Also going to listen to your pulse while I'm here. I just like to verify that everything matches what our monitor said, and that is appropriate. So I'm also just going to have a look at your arms, looking at the overall skin. You have a couple tattoos. They're all healed nicely. This one is quite beautiful. See just a little bit of discoloration here. Is that a birthmark?
Yeah.
Okay. Good. So a couple freckles. No real signs of sun damage. Skin is nice and smooth. Just having a feel of the texture of the hands. No roughness or callus. Fingers are very well groomed, nice and clean. Just checking for capillary refill, which is very well intact there. And then no signs of rigidity of the hands, which is good. Okay, so I'm going to come and perform the same on the other side. All right, so coming over on the left side, I'm just going to feel here as well. So feeling at the shoulder. Just looking for any signs of rigidity or swelling of the joint. Our shoulders carry a lot of weight throughout the day, so I just like to feel around. Nothing notable there. Then again, feeling along the elbow. Good. I'm just going to check your pulse on this side as well. Very good, nice and strong. So I'm just going to have a look at this side. You have a lot of tattoos. How many do you have?
Maybe like 16.
Oh, wow, okay. All appear to have healed very nicely. I don't see any scabbing or anything. Are all of these fairly older?
Yeah, like 3 years ago.
Okay, so definitely nice and healed. Good. Okay. So again, just having a look at the palm. Nice and smooth. Good. Checking again for capillary refill. I'm just going to hold down on your finger and then release and watch for appropriate blood flow return, which is typically within 1 to 2 seconds, which is present here, so that's very good. All right, you can go ahead and relax. So I'm going to come around the back. I'm going to palpate around your neck and then your back and see if there's anything there.
Sure.
Okay? All right, Erika, I don't want to startle you. I'm on the back side of you now. I'm going to start by feeling around at the back of your scalp. So just going to feel again for any abnormalities along the back of the cranium. I find that we tend to hold a lot of tension, specifically at the nape of the neck and towards the back of the scalp. So I'm going to feel here. See if there's anything of concern. Also having a look at your hair. It's nice and thick. No signs of excess shedding. I don't see any shed hairs on the clothing or anything as I kind of move my hands around here. Any tenderness of the scalp at all?
No.
Good. So just going to have a look at your ear, external ears, nice and clean. No signs of discoloration there. So I'm going to come down towards kind of the nape of neck, right at the top of the cervical spine. Just feeling along here. I'm going to come down and I'm going to palpate just right at the spine. So you're going to feel me come right along spinal column. Certainly not feeling any inflammation here, which is good. Okay, so I'm just going to feel along the shoulder as well. Along this side, I'm just feeling for the same thing, just getting a general sense of structure of your back. I don't feel anything of particular concern here. And then if I do some more manual percussing on this side, does that cause you any discomfort? Okay, that looks good. All right. I'm going to go ahead and come back around the front. All of that looks okay. I'll just take my gloves off and we can proceed with the remainder of your examination. All right, so coming back in, I'm just going to sanitize my hands once more. Moving forward with your examination, at this point I would like to test for your pupillary constriction and dilation. So I'm just going to be using a pen light to shine in your eyes. It is fairly bright to start off with. I don't want you to look directly in the light, okay? So I'll have you pick any point across the room, and I'm going to come just a little bit closer to you, so just excuse me here. Just going to have a look as I shine my light. I'm going to start on the right side, test the pupils individually, and your pupils are very reactive. And on the left side. And then if I do a swinging light test, I'm just going to check for consensual and direct response here, which is appropriately reactive. Do you ever have any issues with light sensitivity or and no issues seeing at night while you're driving? Good. So I'm going to bring my light kind of further away here, and if I bring it in close, does that cause you any double vision? Good. And no floaters of your vision, no lights kind of. Good. All right. So now what we're going to do is called a follow the light examination. I will use my same light. I'm going to have you keep your head midline for me, so try not to rotate at the neck. I'd like you to just follow the light with just your eyes, okay? So I'm going to turn here so I have a little bit more range of motion, and if I start here, come to the right side and up, looking for any signs of nystagmus or delay in response. Any discomfort behind your eye as we come towards the outer corner of your visual field? Very good. Okay. All right. All of that looked really good. So I'm going to now come in with my ophthalmoscope. So if it's all right with you, I will have you remove your glasses for just a minute. I'm just going to have a look. This device will allow me to kind of have a magnified look at the back of your eye. So visualizing your optic nerve, your optic disc, the anatomy that allows you to see. Okay. So I will be shining this directly in your eyes and coming very close to your face. I'd like you to just pick a point across the room. So I'm just going to start coming in from the outer corner. Just going to very gently pull down on the lower lid, and optic disc is visualized, nice and clear. Don't see any redness. No signs of inflammation there. That's good. I'm just going to pull up on the upper eyelid here. Can you look down for me, Erika? Perfect. Okay. Same thing on the other side. Just come Coming in from the outer corner once again. Mucosa is normal in color, slightly pink. No abnormal redness. And optic disc is visualized. Okay, all right. Very good. You are welcome to put your glasses back on. And just while I have this out, I'm going to go ahead and just have a peek at the ears, nose, and throat. So do you ever have any issues with your ears as far as like excessive earwax, pain in the ears, ringing of the ears, tinnitus?
Sometimes ringing, and then I had a cold a few years back, and it gave me vertigo.
Oh, and it's lasted still?
Here and there, yeah.
Okay, all right. And the ringing of the ears, does that happen at any specific point, or is it just kind of random?
Random.
Okay. So I'll have a look in your ear and see if I see anything concerning. So I'll just have you turn your head for me. Just gonna move your hair out of the way here. So you're gonna feel me pull kind of down and back, and then insert stethoscope into the ear canal, visualizing the tympanic membrane. See a very normal amount of earwax, nothing that looks concerning. And tympanic membrane is nice and pearly gray. I will say your inner ear canal is very narrow, just kind of naturally, which is fine. Just you may find that your ears get clogged more easily. Same thing coming in on this side. And actually this side is not as narrow. Tympanic membrane is visualized, nice and clear, no abnormal cerumen production. Okay, so slight visual difference from one side or the other, nothing that indicates any cause for concern, just kind of an anomaly in your anatomy. One side is just a lot more narrow than the other. All right. So I'm going to have a look just briefly in your nose. You said you do have some allergies to dust, so just looking for any obvious signs of occlusion or deviation of the septum, any redness. No abnormal mucosa. That looks good. And then if I can just have you open and say, ah. Good. Uvula is midline. And then if you stick your tongue to the roof of your mouth and then down at the soft palate and smile with your teeth. Very good. Very nice teeth. Okay. All right. So I'm just going to catch up on my notes here. So let's see. We performed your ocular examination and all of that was normal. Ocular anatomy is intact. No signs of concern there. I am just going to note that your right inner ear canal is slightly narrow. Not a concern, just in case you should have any signs of infection or anything later, we have it documented there. You said you have a history of vertigo. And was that just like a regular yearly flu, or did you have anything?
It was a sinus infection.
Sinus infection. Okay. Did you have to take antibiotics? All right. Okay. So, moving on. Why don't we conclude your eye examination? So, as a glasses wearer, I'm sure you're familiar with the Snellen chart. I have a pocket chart here, so it's just slightly smaller than what you might be used to seeing at your optometrist's office. So, I'm just going to use this today, and I will use this here. So, I'm going to hold this at about arm's length. I'd like you to just name the letters as you're able to visualize them as I point here. Okay? All right, so I am going to point to the letter, and you can keep both eyes open to start with. So can you read that first letter here?
P, F, P, H.
Good, and if we jump down.
E, P, T, C, O.
And the lowest line.
L, T, F, H.
Very good, okay. So what I'm going to do now is hand you this occluder. I'd like you to hold it up and you'll see that it will just cover one eye. You can choose which eye you'd like to start with. All right. So we're going to repeat a couple of these lines. This time I'll have you start around the middle.
Sure. D, H, J, B, S, L, T, F, P, H.
And if I could have you switch eyes for me.
D, H, J, B, S.
And if we can read the last line backwards.
H, P, F, T, L.
Very good. And if you could tell me what color this is.
Red.
And here.
Green.
Good. Okay. So your vision is right about 20/20 with your glasses. All right, Erika, you did a very good job with that. Your visual acuity was intact. So we can move on from your eye exam. So why don't we go ahead and move into some more of the physical portions of your examination today. So I'm going to test a couple of your reflexes. So I just have a reflex hammer here. I'm going to use this to test the reflexes of the upper extremity and then as well as your knees. So I'm going to start at the elbow here and I will just have you kind of rest your arm very lazily. So don't try to hold the weight, just rest it down. Good. Slightly uncomfortable, that tapping on the bone there, but very good reactivity at the wrist. And then just allow your fingers to kind of rest lazily. Good. Okay. It's the same thing on this side. I'm just going to have you rest the weight of your arm. I'll actually hold your arm here. Good. Maybe slightly more reactive on this side. Are you left or right-handed?
Right.
Okay, you can go ahead and relax. So lastly, just going to test at the knee, so just allow your legs to react naturally. I'm just going to perform a tapping kind of percussion here. Very mild reaction there, actually. Okay. Again, slightly more reactive on that left side. Okay, all right. All right, Erika, so let's go ahead and jump into some test of your hearing, and then I will do some test of your sensory response, neurological response. Okay, so just some issues with vertigo, no other issues with like hearing loss or hearing things that aren't there or hearing things kind of at a diminished level more so than normal. Are you a headphone user, headphones over that, or do you tend to find that you listen to it pretty loudly?
Like medium.
Okay, so as long as you're cognizant of it, just try not to peak if you can, because it can actually cause pretty significant damage to the ear. So what I'm going to do to start with is just kind of perform an exam with my hand. So I'm just going to make a mild snapping noise with my hand on either side. I'm going to ask you to close your eyes. I'd like you to indicate to me with a yes if you hear something.
Okay. Yes. 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 Yes.
Good. Now I'm going to perform a bit more of a specific sound. Can you hear this equally on both sides?
Yes.
And where do you hear it now?
In my right ear.
And now?
Left.
And do you feel vibration here? Can you tell me if this is one louder or two louder?
Two.
Good. Same thing here. Can you feel vibration?
Yes.
And is this one louder or two?
Two.
Good. And I'd like you to tell me what side you hear it on. So now
I'm right.
and now
Left.
and now.
Right.
Now do you hear anything? No.
No. Right. Left. Right.
And tell me when it stops.
Stops.
Very good. Okay. So I don't think there's anything going on with your hearing. I would like to test a couple parts of your sensory components. So let's do. So I'm going to start with something that can be a little bit more difficult to detect because it does also make a sound. For the purposes of this exam, I want you to focus on the feeling. So if I produce a small puff of air on the skin, can you feel that?
A little bit.
Okay. So I will vary. Some parts of it will be pointed at your skin. Some parts I will point directly away from you so that I can ensure you're not just responding to the noise. Okay. So I'm going to have you close your eyes. I'll start on your face. Feel anything there?
Yes.
Feel anything there?
Yes.
Good.
No. No. No.
Just going to fluff your hair here.
Yes. No. Yes. No. No. Yes. No. Yes.
Okay. So now I'm going to vary. I'm going to do some mild touch response. I'm going to use my hands because there were just a couple deficiencies there. So I'm going to touch you just very gently with my fingers. I want you to just indicate when you feel something. Okay.
Yes. 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 Yes.
And does this feel the same on both sides?
Yes.
In here,
Yes.
in here,
Yes.
in here. Down your arms, does that feel the same on both
Yes.
sides? Okay. So I'm going to do some cold response. Now this is pretty cold metal. Can you feel that that's cold?
Yes.
Okay. So I'm going to touch it to your face. You can either say yes or just nod your head when you feel it.
Yes. 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 Yes.
Just going to move your hair here.
Yes. Yes. Yes.
Can you tell me if this coldness feels the same all the way down your arms
Yes.
and on this side as well?
Yes.
Good. And lastly, for your neurological response, I have something fairly sharp. I'm just going to show you here. It's not going to hurt you, but it is very sharp. So I want you to just indicate if and when you feel something, okay?
Yes. 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 Yes.
Any difference in sensation, Erika, as I come down the arm? That all feels the same?
Yeah.
Good. Okay. All right, you can open your eyes. Okay. All right, so let's go ahead and conclude your examination today. So the last few things we tested were for your hearing. All of that was intact. I didn't notice any deficiency there. And then as far as your sensation, that initial test, there were a few things that you got incorrect. It seemed like you were having trouble feeling it. Now, I will say that it is a very delicate response and that it's just kind of aerated. When I retested with my hands and like the softer sensation, you were able to answer appropriately. So that's okay. And then your sharp response was intact and your cold response as well. So that's very good. Don't suspect there's any issues going on neurologically. So as far as your overall head-to-toe examination, I would say that we can conclude that there's nothing going on. I didn't notice any abnormalities. You're probably good to go for about another year. I typically like to test on an annual basis unless there's something specific that you'd like to inquire about. Did you have any questions for me today?
No.
Okay, all right. Well, I will go ahead and put you in for an okay for another year examination, and you are welcome to either schedule that ahead of time or just call in when you're ready.
Okay, perfect.
All right, all right. Thank you so much, Erika. I hope you get home safely.
Thank you.